Fatty liver disease is a condition characterized by the accumulation of fat in liver cells. It is becoming increasingly common worldwide, with estimates suggesting that up to 25% of the global population may have some degree of fatty liver. The condition can range from simple fat accumulation, steatosis, to more severe forms such as non-alcoholic steatohepatitis, NASH, which can progress to cirrhosis and liver failure if not managed appropriately. Identifying the signs of fatty liver disease early is crucial for effective management and prevention of complications. This video will delve into the various signs and symptoms of fatty liver disease, its causes, risk factors, diagnosis, and management options. What is fatty liver disease? Fatty liver disease, also known as hepatic steatosis, occurs when excessive fat builds up in liver cells. The liver plays a vital role in metabolism, processing nutrients, filtering toxins from the blood, and producing essential proteins. When there is an imbalance between the amount of fat entering the liver and the amount leaving, fat accumulates. This excess fat can cause inflammation and damage to liver cells, leading to a range of liver problems. There are two main types of fatty liver disease. Non-alcoholic fatty liver disease, NAFLD. This is the most common form and is not related to alcohol consumption. It often occurs in people who are overweight or have diabetes, high cholesterol, or high triglycerides. Alcoholic fatty liver disease, AFLD. This type of fatty liver disease is caused by excessive alcohol consumption. The liver breaks down alcohol, and over time, heavy drinking can lead to fat accumulation and liver damage. Signs and symptoms of fatty liver disease. Fatty liver disease often does not cause symptoms in its early stages. It is frequently discovered during routine medical exams or tests for other conditions. However, as the disease progresses, some people may experience symptoms or signs that indicate liver damage. Here are common signs and symptoms to be aware of. Fatigue. Feeling unusually tired or fatigued is a common symptom of fatty liver disease. The liver's role in energy metabolism is disrupted when it is inflamed or damaged, leading to feelings of tiredness and weakness. Pain or discomfort in the upper right abdomen. Some people with fatty liver disease may experience discomfort or a dull ache in the upper right side of the abdomen, where the liver is located. This pain can range from mild to severe and may come and go. Abdominal swelling, ascites. As fatty liver disease progresses, it can lead to the accumulation of fluid in the abdomen, a condition known as ascites. This can cause the abdomen to become swollen and distended. Ascites often occurs in more advanced stages of liver disease. Jaundice. Jaundice is a yellowing of the skin and whites of the eyes caused by the buildup of bilirubin, a yellow pigment, in the blood. In fatty liver disease, jaundice may occur if liver damage is severe enough to impair the liver's ability to process bilirubin. Easy bruising or bleeding. The liver produces proteins necessary for blood clotting. When the liver is damaged, clotting factors may be reduced, leading to easy bruising or bleeding. Swelling in the legs and ankles, edema. Edema occurs when fluid accumulates in the body's tissues, causing swelling. In fatty liver disease, edema often affects the legs and ankles and can be a sign of advanced liver damage. Dark urine. Urine may appear dark or brownish in color due to the presence of bilirubin when the liver is not functioning correctly. Loss of appetite or weight loss. Some people with fatty liver disease may experience a loss of appetite, leading to unintentional weight loss. This can occur due to the liver's reduced ability to process nutrients. Nausea or vomiting. Nausea, vomiting, or a general feeling of illness can occur as the liver becomes more inflamed or damaged. Weakness or confusion. In severe cases of fatty liver disease, weakness, confusion, or difficulty concentrating may occur due to the liver's impaired ability to remove toxins from the blood. Causes and risk factors. Causes. Obesity. Excess body weight, especially around the abdomen, is a significant risk factor for fatty liver disease. Insulin resistance. When cells become resistant to the effects of insulin, the pancreas produces more insulin, leading to increased fat accumulation in the liver. High blood sugar, diabetes, uncontrolled diabetes can contribute to fatty liver disease. High cholesterol and triglycerides, elevated levels of these blood lipids can lead to fat accumulation in the liver. Excessive alcohol consumption, chronic heavy drinking can cause alcoholic fatty liver disease. Medications. Some medications, such as corticosteroids, tamoxifen, and certain antiretroviral drugs, can contribute to fatty liver disease. Risk factors. Obesity or overweight, especially if fat is concentrated around the abdomen. Type 2 diabetes or insulin resistance. High blood pressure. High cholesterol or triglycerides. Metabolic syndrome, a cluster of conditions that increase the risk of heart disease, stroke, and diabetes. Sleep apnea. Polycystic ovary syndrome, PCOS, common in women and associated with insulin resistance. Age. Fatty liver disease is more common in people middle-aged and older. Certain ethnic groups. Some populations, such as Hispanics, are more prone to NAFLD. Family history. Having a close relative with fatty liver disease increases the risk. Fatty liver disease is often diagnosed through a combination of medical history, physical examination, and tests. Here are common methods used to diagnose the condition. Blood tests. Liver function tests. These tests measure levels of liver enzymes and proteins. Elevated levels can indicate liver inflammation or damage. Complete blood count, CBC, to check for anemia or abnormal blood cell counts. Blood lipid profile. Measures cholesterol and triglyceride levels, which can be elevated in fatty liver disease. Blood glucose levels. High levels can indicate insulin resistance or diabetes. Imaging tests. Ultrasound. A non-invasive test that uses sound waves to create images of the liver. It can detect fat accumulation and help assess the liver's size and texture. Computed tomography, CT, scan or magnetic resonance imaging, MRI. These imaging tests can provide detailed pictures of the liver, helping to evaluate the extent of fatty infiltration and detect any complications. Liver biopsy. A liver biopsy involves taking a small sample of liver tissue for examination under a microscope. This is the most accurate way to diagnose fatty liver disease and assess the degree of inflammation and scarring. However, it is an invasive procedure and is usually reserved for cases where the diagnosis is unclear or when other liver diseases are suspected. If left untreated, fatty liver disease can progress to more severe conditions, including non-alcoholic steatohepatitis, NASH. NASH is a more serious form of fatty liver disease characterized by liver inflammation and liver cell damage. It can lead to fibrosis, scarring of the liver, and eventually cirrhosis. Cirrhosis. Cirrhosis is advanced scarring of the liver caused by long-term liver damage. It can lead to liver failure, portal hypertension, and other complications. Liver cancer. Chronic inflammation and liver damage increase the risk of developing liver cancer, especially in cases of advanced fatty liver disease. Liver failure. In severe cases, fatty liver disease can progress to liver failure, a life-threatening condition requiring immediate medical attention. The goal of managing fatty liver disease is to reduce fat accumulation in the liver, prevent liver damage, and improve overall liver health. Treatment and lifestyle changes often focus on weight loss. Losing weight through a combination of diet and exercise is one of the most effective ways to reduce fat in the liver. Even a modest weight loss of 5–10% can lead to significant improvements. Healthy diet. A balanced diet rich in fruits, vegetables, whole grains, and lean protein can support liver health. Limiting saturated fats, sugars, and processed foods is important. Regular exercise. Physical activity not only aids in weight loss but also improves insulin sensitivity and overall metabolic health. Managing underlying conditions. Controlling conditions such as diabetes, high blood pressure, and high cholesterol can help prevent further liver damage. Avoiding alcohol. For individuals with alcoholic fatty liver disease, eliminating alcohol consumption is crucial. Medications. In some cases, medications may be prescribed to manage underlying conditions or improve insulin sensitivity. Monitoring. Regular follow-up appointments with healthcare providers are essential to monitor liver function, disease progression, and the effectiveness of treatment. Liver transplant, in severe cases. For individuals with advanced cirrhosis or liver failure, a liver transplant may be necessary. Prevention. Preventing fatty liver disease involves adopting a healthy lifestyle and addressing risk factors. Maintain a healthy weight through diet and exercise. Eat a balanced diet rich in fruits, vegetables, whole grains, and lean protein. Limit sugary foods and beverages. Exercise regularly to improve metabolic health. Avoid excessive alcohol consumption. Manage underlying conditions such as diabetes, high blood pressure, and high cholesterol. Get regular medical checkups to monitor liver health. Fatty liver disease is a common condition that can lead to serious complications if left untreated. Recognizing the signs and symptoms early is crucial for diagnosis and management. Lifestyle changes, including weight loss, a healthy diet, and regular exercise, are key components of treatment. Managing underlying conditions and avoiding alcohol are also important. With proper care and attention, many people with fatty liver disease can improve liver health and prevent progression to more severe forms of the disease. If you suspect you may have fatty liver disease or are at risk, it is essential to consult with a healthcare professional for evaluation and personalized guidance.